Hello everyone, welcome to my YouTube channel. Today I'm going to be going through biomedical science job interview questions as regard to biochemistry questions, and this is part 1. So what I intend to do is to provide a comprehensive answers and maybe how you can possibly structure your answers and the things you might need to think about when you encounter such questions. Okay, obviously the questions I'm going to be sharing are following the previous interview questions that some people have attended and sent me the question. So I'm going to try to provide an answer. I will try not to teach where possible so that we can be able to go through the questions without necessarily causing a delay in providing the answers. Anyway, before I continue, my name is Dr. Emmanuel Ogbodo. I'm a biomedical scientist and I'm also a lecturer in biomedical science here in the United Kingdom. Let's get into this. So the first question is, tell me what you think about these results. What do you think about this result? So they provide a result of sodium, obviously electrolyte, sodium, potassium, calcium, creatinine, total protein, albumin, bilirubin, alkaline phosphatase, and alkaline transferase. So they provided all of this, and asked, what do you think? So I was the one that had to, they didn't give the person the reference ranges, okay? So I provided the reference ranges for you guys so that it can help in the interpretation of this result. Obviously, as a biomedical scientist, I had always said that once you encounter any result, okay, that is trapped on your queue, the analyzer expects you to investigate the software, the laboratory information system. Once it's trapped there for you to validate the result or authorize the result or release the result, you are then expected to make a scientific judgment to see whether or not that result is consistent with that patient. So obviously, when you look at this, there are some few things you are going to see. Number one, you will see that the sodium is raised from the result you can see here. You can also see that the potassium is raised from what you can see here. You can see that the calcium is low from what you can see here. You can see that the creatinine is low from what you can see here. Then obviously, total protein, albumin, bilirubin, and ALP and ALT, they are all normal. So what does this suggest? So let's look at the answer. So because like I said, I will try not to teach, but to provide us a comprehensive answers, okay? Now, in providing the answer of the question number 1, there are a few things that you might need to consider. Remember that the electrolyte, potassium and sodium is high, okay? Remember that the creatinine was, I think, low, and remember the other results. So now, it means that you might need to start asking yourself, is there any problem with number 1? Is there any problem with the kidney? So why would you consider the kidney? You are considering the kidney because the creatinine obviously is low, and of course the electrolyte is also low. So these are the things that can be associated with kidney dysfunction. So you are querying it. I'm trying to tell you how to answer the question. So that could be what it suggests, okay? Don't rush into some other things that I'm going to mention. Remember, I'm providing you answer on how you can be able to structure your answer. Sometimes when you guys go for interview, you rush into the main answers without providing a general view of what that actually means. So you can query kidney dysfunction because of the abnormal level of sodium, potassium, and of course creatinine. Okay. Now the next thing I need to look at is bone and muscle dysfunction because of what? The calcium is low. Remember, the calcium play a role in bone, okay, making sure that the bones are strong as the case may be. So again, I'm trying not to teach. So that is what you might need to query. So you are querying kidney dysfunction, you are querying bone and muscle dysfunction. But interestingly, you are not going to query liver function test because why? It appears normal. Why? Because the ALP is normal, ALT is normal, albumin is normal, bilirubin is normal. So because they are all normal, it doesn't suggest there's anything wrong with the liver. I hope that makes sense. Now, because you have laid that foundation, then you can say, however, because remember, you are making a judgment. You are trying to find out, why should the sodium be high? Why should potassium be high? Why should the creatinine be low? Does that make sense? So these are the things that you might need to consider. Why is that supposed to be the case? Does that make sense now? Okay, so you can just say, however, even though that this, like I've mentioned, it suggests kidney function, kidney dysfunction, bone and muscle dysfunction, it suggests that the liver appear normally functional. So but there are other things that need to be investigated. We need to now confirm whether the result is consistent with the patient, to find out whether the sodium being high, potassium being high, and all of that, whether it is consistent with the patient. So that is where the however comes in. So because you say however, you can say you are querying sample contamination. Why are you querying sample contamination? Because remember, with the contamination of potassium EDTA, okay, or sodium citrate, okay, or even sodium chloride IV or IV fluid, it can affect the result. For example, potassium EDTA can affect the level of the potassium, okay, we've already said that on the previous video, and sodium citrate can also affect, sodium citrate and sodium chloride IV can affect the sodium level. So these are the form of contamination of the samples. So once that contaminates the sample, it might give you a false result. So what you are now querying, the raised level, the high level of the sodium, the high level of the potassium, could it be due to sample contamination? The next thing you might need to now ask yourself, why should the potassium be high? Okay, so maybe in the case of the potassium, you might be looking at, is there any possibility that the sample has been hemolyzed, or is it an old sample, or is it squeezing? So we already have a video on that, so you can listen to that. So these are the things you are querying. Now, this is how to answer question. You first of all say what the result suggests. Then you can say, however, and start bringing out what are the possible factors that could actually affect that result. I decided to present this in PowerPoint so that it can help me to bring out the necessary points that you guys need to consider. Okay, now if you investigate any of this, if you find out that the result could be due to contamination, or you find out that the result could be due to hemolysis or old sample or ion squeezing, as the case may be, what do you need to then do? Because it means then that the result you are saying, the potassium is not reliable. The result you are seeing means that is a false raised potassium, is a false raised sodium, okay? Obviously, the creatinine being low as well could also be abnormally, okay? So meaning it is false low creatinine as the case may be. So what are you going to do? In a case of contamination of potassium EDTA, what are the likely parameters that it can be affected? Or sodium citrate or sodium chloride, what are the parameters that can be affected? Those parameters that can be affected, you might need to knock it off. You might need to delete it, as the case might be. Okay, so let's look at it. So you might need to then delete calcium, because calcium is going to be affected. You might need to delete sodium, because sodium obviously is affected, potassium is affected, creatinine is affected, and the ALP is affected. Okay, now let me mention a few things here, which we already had on our previous video. There are a few more information I'm going to give, because on the previous video, we have already explained how calcium can be affected, including magnesium, of course. Magnesium can also be affected. We've already explained that the potassium EDTA will chelate this, okay? Even sodium, of course, they will chelate it, and the chelation will then mop up this calcium, or may mop up magnesium, and the mop up of that very calcium or magnesium is what that can lead to the low calcium or low magnesium, as the case may be. So that's why you might need to delete it. Now you can see, even though we are seeing low calcium, obviously if the sample is contaminated, there's a possibility that that low calcium you are seeing is abnormal, is a wrong result, is a false low level calcium. So that's why we may have to now delete it. Obviously the sodium, why we have to delete it is because obviously is contaminated by sodium citrate or sodium chloride IV. That is if suspected, if confirmed. Of course, potassium if contaminated by potassium EDTA, obviously. Now let's look at the creatinine and ALP, because the question is, why should we not have, what is the relationship between this contamination and that of the creatinine and ALP? And obviously someone has asked me questions saying, I have done a result in the past, as a biomedical scientist, I realized that potassium EDTA contamination lead to low level of the ALP. Why should that be the case? So, and this is where I'm going to provide the answer. Okay, so first of all, let's look at how this contamination of maybe potassium EDTA or sample contamination can lead to the low level of creatinine, or even or affect creatinine result, or affect ALP, as the case might be. The first one we're going to look at is alkaline phosphatase, which is ALP. Remember, this is a kind of enzyme. ALP is an enzyme, and for them to be able to carry out their activities, they need some metals, they need some ions to be able to carry out these activities. So they need something like zinc, they need something like magnesium, okay, to be able to carry out these very activities, okay. So what it means is that these ions they need work as a cofactors in helping their activities. Therefore, if this ion has been mopped up by chelation due to the EDTA, that means that activity of ALP can be affected, and that is why it can be low. And that is where I said in the previous video that when you see low level of ALP, okay, it does not necessarily, even when you see it normal, actually that was what I said, when you see it to be normal, it does not mean that sample is not contaminated. There's a possibility that ALP is supposed to be high, but because of the contamination, it reduced the ALP from being high to normal. So anyway, let me explain the point. So why should the potassium EDTA or chelation, okay, affect it? Now this is because ALP is enzyme that require metal ions like zinc and magnesium for its activities. Now look at what EDTA does. So EDTA is a strong chelation agent that binds these metals ions, and once that are binding, the activity of ALP is going to be affected, and once that is affected, without these cofactors, then the enzyme activities of the ALP is going to be inhibited, and that is how that's the relationship between this EDTA contamination and the ALP being low, or if supposed to be high, it becomes normal. I hope that makes sense. Now let's look at that of the creatinine. Obviously, with the creatinine, of course, we are going to also look at the contamination, okay, maybe with this EDTA as well. So now, remember, once there's a contamination by either EDTA or sodium citrate, as the case may be, it's going to form a complex. Don't forget that in biochemistry, most of the results that you get, okay, develop color. So the analyzer is able to give you absorbance, and that absorbance is what that generates the concentration using the calibration curve or standard curve, as the case may be. Okay. Now, what it means is that the complex formation between the EDTA and that of the protein, which is now the protein, will now form a coloration, and that it means that that coloration formation can then affect the actual coloration that's supposed to be given by creatinine. So that is how it can affect the result. Now let's see that. EDTA form a complex with the reagent. So that complex is formed with the reagent will then produce a color development, of course, which is the colorimetry. And that very coloration that it produces is a false color. Why? Because of the complex formation between the EDTA and the reagent, and that can give you a wrong creatinine result, and that is why it can then affect the level of the creatinine. Now, there's also another aspect of this. Remember, EDTA can form a liquid. It contains a liquid. Even though it's an anticoagulant, it contains a liquid. And that liquid of the EDTA can actually dilute the sample, and that can then lead to the low level of creatinine. I hope that makes sense. So what if that EDTA contain liquid from EDTA, okay, and that can slightly dilute creatinine level. Now, what it means is that with the EDTA contamination, it's likely to give you maybe wrongly false high level of the creatinine, or it can give you a false low level of the creatinine. In terms of the high level of the creatinine, it forms a complex, okay, with the reagent, and that can give you a false raised creatinine level result. And while if it's the liquid from the EDTA, it will then dilute it, and that can give you false low level result. I hope that makes sense. So I've been able to link EDTA contamination with the creatinine and alkaline phosphatase. So let's look at the next question. So look at question number 2. Tell me what you think about this result. Obviously, again, sodium has come again, potassium and all of that. But there is something you have to notice here. Unlike the previous result, you are going to see that the potassium here is normal, sodium is normal, creatinine is normal, total protein is normal, albumin is normal, bilirubin is normal, ALP is normal, ALT is normal. The only thing that is low is TSH, which is thyroid stimulating hormone. I hope that makes sense. In fact, let me also say something that I forgot to say in the past, in the previous question 1. Remember that things like remember that most of the proteins, by the way, are produced in the liver and kidney. Don't forget that. Most of, like all these your clotting factors, most of the protein, by the way, are produced in the liver and kidney. Now, significantly anyway in the liver. Now, the point I want to make is this. The total protein, albumin, bilirubin, ALP, ALT, this talk about the liver. It helps to suggest the liver function test. It gives you the idea how well the liver is functioning, okay? And obviously the creatinine, it gives you the idea of the renal function test. Anyway, let's not bother about that. So you can see that thyroid stimulating hormone is the only thing that is low here. How would you then interpret the result? Now, in the result interpretation, remember what I said. Don't just jump into talking about the thyroid stimulating hormone. First of all, show that you are aware that some results are normal, okay? Don't forget that. So what it means that you are going to see that the kidney and the liver function test appear normal. That's what it means, okay? It appears normal. They are all of them. They are normal actually, okay? Now, you now need to now dive into actually what is abnormal. But you now say, however, thyroid stimulating hormone, which is TSH, is low. And what does that really indicate? So we now need to find out what is the indicator of thyroid stimulating hormone being low. There's a number of things. Remember, it's the thyroid. So meaning that it's a thyroid related condition. okay? It's a thyroid-related condition. So what is a thyroid-related condition? And what it then means is that this can now be due to maybe something like hyperthyroidism, okay? Meaning that there may be a kind of inflammation with the thyroid, or what you can call thyroiditis, okay? So that could be as a result of that. So hyperthyroidism or thyroiditis, which can be suggestive of, inflammation of the thyroid, okay? Or maybe you can also have maybe someone who is taking a thyroid medication. Excess thyroid medication can also lead to that. Now, what are other things that can lead to that? If there's a pituitary dysfunction, remember the relationship between the pituitary and that of the thyroid. So pituitary dysfunction, or maybe like tumor or surgery, radiation or hypopituitary can cause this very thyroid stimulating hormone to be low. Why? Because of the relationship, okay? So remember, this question and answer is to give you idea of the things you need to talk about when you go for your interview. If I were you, while I'm providing the point and few explanations, try as much as you can to put more flesh to it, so that when you go for interview, it can enrich your answer. Don't forget that the answers you are seeing here, you are not the only one listening to it. Other person are listening to it. So other people are also listening to it. Therefore, if I were you, I'm going to go even extra to be able to make sure that I provide even more detailed answer. But this is the structure that I'll suggest that you make use of. Now, another thing that can lead to that is in the case of pregnancy. Why? Because of HCG, which is the hormone that is stimulated during pregnancy, can actually suppress this very thyroid stimulating hormone. So these are the few things that it can indicate. Remember, we are not saying from the result of the question 2, every other thing appear normal, both the liver and kidney, apart from the thyroid. Okay, so meaning that we are suspecting thyroid stimulating hormone dysfunction. So there is a thyroid dysfunction. Okay, remember, it's a thyroid stimulating hormone. Thyroid stimulating hormone. So TSH is as a result, is a stimulation, is a product of the thyroid function, is a product of thyroid hormone. So once the thyroid hormone has been stimulated, that's the TSH. Anyway, let me not teach. So let's go to continue with the answer. What are the symptoms that can be associated with this? You can have weight loss, rapid heartbeat, anxiety, increased sweating, and many other things like I've highlighted here. Why did I put the symptoms? I purposely put the symptoms should, in case you go for interview and they present the result and also give you the symptom. Maybe they say a TSH level of a patient is this, that, which shows a symptom of this, that. So this can help you to now know the symptoms associated in a case of thyroid dysfunction, as has been reflected in the thyroid stimulating hormone. I hope I've been able to make this comprehensively, okay? Now, let's go to the next question. What other tests can be done when there is low TSH? Remember, he's talking about thyroid. That's why I say TSH means thyroid stimulating hormone. So it is actually thyroid hormone in stimulation. So following the activation of thyroid hormone, you now get thyroid stimulating hormone. Anyway, that's by the way. So what are the other tests we can? So once we suspect that there is a low level of thyroid stimulating hormone. Now, let me just say something here. I'm trying not to teach anyway, but let me say something. What it means is that if the thyroid stimulating hormone is low, maybe there is something wrong with the thyroid itself, because the TSH is a product of the TH, which is a thyroid hormone. I hope that makes sense, okay? Now, so what are the other tests? Number one, you are going to look at free T4 and free T3. So that will give us the actual thyroid hormone level. It will help us to understand what is the level of the thyroid hormone. Is it normal or is it abnormal? I highlighted this yellow because this is a common one they do in biochemistry. T4 and T3. In fact, in most cases, it can be a routine test. Okay. Anyway, let's continue. So, thyroid antibodies, you can also check for autoimmune thyroid disease like Graves' disease. So, that is also another test that can be done. Then you can now look at example of this very thyroid antibody. Could be anti-thyroid peroxidase, anti-thyroglobulin, TSH receptor antibody. So, these are the things that might need to be investigated. Now, there's also another test you might need to do, and that is called thyroid ultrasound. However, remember, ultrasound is not done in the pathology laboratory. It's for the radiography and all of that. So, but it's not wrong if you can mention that. I hope that makes sense. Okay? Now, let's go to question number 4. Tell me about what your experience is in the chemical pathology department. Now, if you have listened to my video on your experience in hematology, the same format. What are your experience in chemical pathology? The question is, what are the activities that goes on in chemical pathology, in biochemistry? What happens there? There is a number of things that happen there, obviously. You talk about in terms of maybe sample handling, even sample reception, okay, you talk about it. Every department in the pathology laboratory deals with the sample reception. So you talk about sample reception, you talk about sample handling. In fact, in biochemistry, sample handling is so important. For example, the way you handle the sample can cause hemolysis. The way the sample is centrifuged can cause hemolysis, okay? So sample handling is very, very important. The way the sample is separated, aliquoting, and all of that can affect the result. So it is important you mention something like that. Now, obviously, there are things like maintenance, okay, troubleshooting, calibration, validating of results, and so on and so forth. Even knowing when you can, when something is urgent, okay, what to do. Even with your experience in participation of maybe proficiency testing, like in terms of the NEPAS, okay, you know, that is also very, very important. Even with your experience in participating in the laboratory accreditation, that is also important, like the UCAS. Even with your participation with the auditing and all of that, quality control, these are your experience in biochemistry. Please, it's not just biochemistry. This can be your experience in any other department. If you look at this, there is not going to be any much difference between this and that of the experience in hematology. The only difference is that I'm going to be making more of biochemistry than every other department. If you switch it to other departments like microbiology, it will also be the same thing. So the test I'm going to be mentioning, the method, the analyzer I'm going to be mentioning, some few things I'm going to be mentioning is going to be more of biochemistry than every other department. But it could be microbiology, it could be hematology, it could be blood bank, it could be immunology, it could be histopathology. Okay? Now let's go into that. Tell me about your experience in the chemical pathology. So I think I've laid that foundation. Number one, sample analysis and sample and testing. So meaning, how do you analyze sample? That you have competence in the analysis of the sample testing, like a LFT, you know, which is a liver function test. You look at renal function test, electrolyte, glucose. So basically, you can call this a routine test that you are competent in handling sample analysis and testing in terms of the routine tests, such as you can mention anything like this. Okay, then you can also look at handling and processing sample like reception, labeling, centrifugation, aliquoting, you know, etc. Overall, maintain sample integrity. What is it that you are competent in how sample can be handled and processed in biochemistry? This is to make sure that the sample are well labeled, okay, well centrifuged, aliquot. This will help to maintain the sample integrity. Why? Because if that is not properly handled, it can affect the sample integrity, and that can give us a wrong result. The next one, that you are competent in the instrument operation and maintenance. This is talking about maintenance of the analyzers, calibration, you know, quality control, all of those is troubleshooting the analyzer and all of that. This is just a few examples of some analyzer that they use in biochemistry, like the Roche Cobalt series, Abbott Architect, and Beckman Coulter AU series. So you can put any of the analyzer as you want. If you can actually give them specific code, that would be great. I hope that makes sense. So you say you are competent in how to operate that very analyzer, maintain that analyzer, calibrate it, and so on and so forth. So we are also going to continue with the answer. The next thing I'm not going to talk about is that you are competent in the analyzer troubleshooting, like I've already said. In that analyzer troubleshooting, you are competent in the calibration, maintenance, quality control, which help for what? Precision and accuracy. Why? If the calibration, maintenance, and quality control is not properly done, that can affect the precision and accuracy of the laboratory results obtained. And that means that the laboratory is going to be, you know, they're not going to be within conformance, okay? It's going to be a non-conformance, and that is why it's important. Obviously, you can also mention the quality management system here, how competent you are with the quality management system. You can also say that here as well. Now, you now talk about quality control and assurance, proficiency testing, like NEPAS, okay? You now talk about auditing, UCAS and NEPAS, and ISO laboratory standard, you know, you can mention your experience in all of this. Now, at this point now, this appears generic of every other department, but obviously we are talking about biochemistry, so it's important that you also mention this. I think I forgot to mention something like quality management system in my outline. Please, you can also include that. Obviously, most of the things we are mentioning here, they are quality management system, but it will be important that if you can lay it as a foundation, which can now set a scene or lay a background for most of these things now that I'm saying, like quality control and assurance, calibration, and quality control, maintenance, and so on. I hope that makes sense. The next thing you can talk about is data management and reporting. Now you are competent in the how to manage data and reporting, and this talk about result validation using laboratory information management system, data entering, tracking, data and result release. So what it means that when we validate result, okay, obviously using the laboratory information system, okay, that validation means that we can then release it, and that can now go into a is a form of data entry, okay, and that can also help us to track the data. Remember, in validating result, you can actually check the patient previous result. In other words, you can actually track the patient previous result to see if it is consistent with what you are seeing. Like I said, I'm trying not to teach, just to give us, what you need to think about. Now, you can also mention something like your competency in training and development. How you are competent in training staff, okay, and making sure you also you are competent in making sure there's a development of documents update, okay, where you can update SOP, making sure that if there is anything that you find that that we might need to include or remove in the SOP to ensure that the laboratory function at the optimal standard, that you are competent on how to do that, how to update the SOP and so on. Okay. Obviously, the answer is going to continue. Then you can now mention the skills you have. You now talk about your analytical thinking. Your analytical thinking here means that your scientific background thinking that you use in validating results. That is analytical thinking. So your skills about analytical thinking, communication, team collaboration, which is teamwork, attention to detail, and many things, okay? Hard working, multitask, anything that you want to put there is important that you also include that. Now, it's also important that you also mention how you can be able to contribute to the overall success of that department. What are your impact and contribution? Now, you can now mention about how your experience has helped in improving the turnaround time, which is TAT. Okay, how you have helped in maybe in development of the new SOP or successful accreditation or re-accreditation, meaning your participation in successful accreditation like UCAS accreditation, and also your participation in your effort in participation of the re-accreditation. Okay, so that is very, very important that you include any of this. I hope that makes sense. So these are your experience in biochemistry. Okay, so remember, it is generic, but you need to be talking more about the biochemistry. That is why mentioning those tests where possible also comes in, like I highlighted at the previous, at the beginning of the answer to this question. Okay. Now let us look at question number 5. What do you think about shift rotation? What do you think about shift rotation? Obviously, this talk about 24-hour service. That's just what it means. Okay. Now there are things I'm going to say here that most times we don't consider when such a question comes in. But let me say it. Remember, even don't just go ahead talk about maybe 24-hour service. Shift rotation also, it comes with challenges as well. Okay, there are there's also some disadvantage of this very shift rotation. It's also important that you highlight it, and of course also highlight where quality management system comes in to mitigate it. That will also help. Hopefully this is going to be a new thinking of something for you to consider. Everything I'm doing in this video is to help you guys to know how to structure your answers and make sure that your answers are detailed, comprehensive, making sure that you provide all the detailed answers in such a way that the panel is going to be pleased with the way you structure your answers and the way you go about giving your answers. So number 1, you need to make sure that you need to know that this shift rotation ensures there's a continuous and efficient operation of laboratory services. It ensures there's a continuous, that means there's no any breakage in the services that we provide in the laboratory. So it runs 24 hours, okay? It runs 7 days a week. It runs 31 days or 30 days in a month. It runs 365 days in a year. It continues running. There is no any breakdown. That means that even if it is something is emergency, there is always someone in the laboratory that can handle it. Like I said, this approach has a several benefits, and of course, it also has challenges. Obviously, the benefit is that it provides services without breakage, okay, but it also has its own challenges. it can actually impact both the quality of the laboratory services and the well-being of the staff. What it means that the shift rotation, okay, the 24-hour services that we give can actually impact on the quality laboratory, the services that we provide. It can also impact on the well-being of the staff. If a staff is too tired because of the shift that staff is doing, it doesn't matter how good that staff is going to impact on the quality of the service that staff is providing. Meaning that it's also going to impact on the well-being of that very staff. So we're going to look at that in detail. Now let's continue with the answer. Number one, you're going to see is a 24-hour, 7 days a week operation. Laboratory services are available, and it's crucial for emergency cases and inpatient care. Remember, there's always patients in the hospital. So those patients in the hospital, we continue to care for them at 12 midnight, 1 a.m. It doesn't matter, any time that they want to review, that the clinicians want to review them and send the lab sample. Someone needs to be in the lab to be able to run it, okay? And also, it's crucial in a case of emergency. Imagine if there is accident on the motorway by 2 a.m. Someone needs to be in the laboratory to be able to provide the services once that is required. Anyway, so improved coverage. So there's adequate staffing level, okay? That's also one of the benefits. It improves coverage of the laboratory services by ensuring there's adequate staffing level. It manages workload effectively and maintain the quality of services that is provided. These are the benefits. These are the reason why it is there, okay? Because one person cannot do everything. So with a 24-hour shift rota, we can then plan what are the man workload we need. Who should be, how many people do we need in the morning? How many people that need to come late? How many people need to be at night? That helps them to plan it, to make sure there's adequate staffing level. And this is appropriate based on the workload. So, and that is how to manage the workload effectively. Okay? And can I say this? When you hear about locum, this is where locum comes in. So when a laboratory cannot be able to manage its workload because of the short staffing, then they can make use of locum. I hope that makes sense. Now, of course, it also helps in a skill development. For someone to be effective and a good biomedical scientist, you must be involved in 24 hours operation of laboratory services, because that will expose you, to a variety of tests and procedures, and that can obviously enhance your skills and your experience. Another aspect of this is a teamwork. It provides opportunity for staff to work with different colleagues. So it can help you to work with many people in the pathology laboratory. And because you work with many people in the pathology, different people, in fact, even from different departments, let's say you're in biochemistry, so it gives you the opportunity to work with specimen reception and staff member. It gives you the opportunity to work with someone in hematology and blood bank, okay? It gives you the opportunity to work with many people. Why? Because, that interaction can help you obviously to collaborate with staff. It encourages teamwork spirit. Now, the answer obviously continues. Now, with the 24-hour service, it's improving flexibility. So, it brings a work balance for staff. So, there are some staff that like to work during the night because that's work for them. Some people like to work during the day. That is what work for them. Some people like to do late shift. That is what work for them. So, that flexibility that it gives, imagine that you have a GP appointment, okay? And you notice that your GP appointment is in the morning. So it can give you opportunity to come for a late shift and attend that GP appointment in the morning. So imagine that you want to, maybe there is something that is happening in your child's school, as the case may be, and it is maybe, let's say, something like by 4 p.m. The flexibility can actually make you to decide to do a night shift, okay? So you can attend that. So there are flexibility, okay? And that helps. Even though that the laboratory can run over the weekend, okay? It also means that some people will be at work over the weekend. Some people will also be at home to stay with their family and so on. And this can help. That shift rotation brings that flexibility, and that is also help to bring the work balance. Obviously, when managed very well. Now, even though that is the case, it also has challenges. The challenges it has is, number one, it can disrupt of cardiac rhythms. What it means, someone's sleep can be affected. The cycle of someone can be affected. Let me give you an example. You are on a day shift, maybe for 2 weeks or 3 weeks. Now, suddenly, you are now on the night shift. that change, that sudden change can affect you, okay? Even though it brings a flexibility, it also can disrupt your sleeping style, okay? Because if you do morning shift or day shift, you finish by 5:30 or 5 o'clock, you can go to bed early. But when you are supposed to do night and you're starting by 7 or by 8 or by 9, as the case may be, that will affect you. Your body will then need to adjust. Imagine after your body finishes adjusting, you now go back to late shift. So that altering of your cardiac rhythms is actually a challenge that comes with it. Another challenge is the work-life balance. It can actually affect work-life balance if not properly structured or maintained. Of course, it can also affect training and consistency. This is actually one of the main problems of this rota. For example, you will see someone who's supposed to be the one training the member of staff. The person is now on maybe a night shift or late shift. The person doesn't have time to train that member of staff because the person does not have the time. It can affect the training, okay? And obviously, it can also affect consistency. So you started training in inspection reception. Now, suddenly the person training you has now gone on night shift. You are stuck there, and someone come again and say, okay, let me train you here. And they start training you on how to run the analyzer, and then the person go off again and start doing night shift. And so that inconsistency can be affected, okay? That consistency of making sure the ideal way of training someone is starting with the person sequentially and finish it. Then the person can move to the next one. But because of these very challenges of short staffing in maintaining the rota, it can actually affect both the training and consistency of the training, okay? That means that there can be also a communication gap, because in these 24 hours, okay, we can do a handover. And in the process of that very handover, information can be watered down, and that can lead to a communication gap. Imagine that something happened in the morning, and you came on late shift, someone told you what happened on late shift. Now you are supposed to hand it over for the person coming on the night shift, but for some reason you forget some aspect, or you may even forget, and that can be a gap in communication, okay? Let's still continue with the answer. Now, what are the strategies? The strategies to mitigate these challenges, obviously, that is where the quality management system comes in, and that is where the 24 hours, 247 rotas actually comes in. The managers make sure they structure it in such a way that challenges is going to mitigate it. So the structure scheduling, they make sure the structure is very well, okay? They make sure that it is adequate, it has the adequate rest period, okay? They make sure that it mitigates with the health and the well-being awareness program of the member of staff, making sure that the health and the wellness of the staff, is well put into consideration, okay? They also make sure that they put up a structure that can ensure that effective handover. That is where you can see a handover form. The things that you might need, sometimes it gives you the indication of something that you might need to actually talk about during your handover. So it encourages effective handover. Of course, it also structured in such a way that it can encourage training and support. So this is where the laboratory managers comes in, or the senior member of staff comes in, to make sure that even though there's a challenges with this rotation, that is mitigated. I hope that makes sense. Question number 6. What do you do when you get hyperlipemia or lipemic sample, okay? Obviously, if there's a hyperlipemia, it means that there's abnormal high concentration of lipids such as triglycerides, okay? So when there's that abnormal, high concentration of lipid is going to affect the result. Yes, it will affect the result. So what are you going to do? Number 1, what you do is to do virtual inspection. You're going to do your initial check and documentation. You need to comment on the sample appearance as the case may be. So that your visual inspection is important, okay? And of course, that will lead you to the centrifugation, which can now give you the extent of the lipid. I don't know if that makes sense. So what's the extent of the lipid? So that is what centrifugation can do for you. Now, this will obviously is going to interfere the result. Why? Because in biochemistry, we use what we call maybe something like spectrophotometric measurement, or maybe enzymatic reaction. So with this very lipid, it's going to interfere with that. It's going to form a kind of complex. It's going to affect the coloration, the color that is going to be produced. It will be affected, and that can give you a false result. And of course, it can also interfere with the enzyme reaction, and that can also affect with that very result. So whether you are using spectrophotometric techniques or enzymatic techniques, reaction techniques, it will affect the result. And that is why it is important then what you are going to do when you notice that in some cases what you do is to dilute the sample. You can often dilute the sample using a saline or another buffer. The dilution will then help you to manage it, to reduce the concentration of that very lipid, okay, in such a way that it cannot interfere with the result. But unfortunately, obviously, it comes with its own disadvantage. So dilution reduces the lipid concentration to manageable level. It doesn't mean that it has taken care of the whole situation. It can help to reduce the concentration to the where you can manage it and at least have an idea of what the patient condition might be. Okay? Now, obviously, the answer continues. Now, you then need to apply appropriate dilution factor. For example, in some laboratory, they will multiply result obtained by what? 1.2. What it means that whatever concentration you are using to dilute, whatever factor you are using to dilute, dilute that very plasma or serum that is full of lipid, you also multiply, because I want to give this just a pure science. Okay, if you do something like maybe 1 in 2 dilution or 1 in 3 dilution, you need to also compensate that dilution. Okay, so if you dilute something by 1 in 3, by the time you get the result, you need to multiply by 3. That's just what it means. Okay, so if I have a concentration that I've diluted and I get 5, and I need to say 5 times 3, okay, whatever thing it gives me is the result of that, which is 15. I hope that makes sense. So you now need to apply the dilution factors of what you have used. Now, apart from the maybe using what's it called, normal saline, okay, to be able to dilute it, there's also what is common in pathology laboratory. They can use what we call lipid clearing agent like LipoClear. So this is a known ionic and non-toxic polymer that can bind and precipitate lipid. What it does, once you use this LipoClear, it's going to precipitate the lipid. Okay, it will precipitate it. That will help you to now remove the lipid. Does that make sense? Then run the sample. But the problem with that, it can affect some results, and therefore it may not be suitable for some tests, such as maybe creatinine kinase or gamma GT or CRP and others. It may affect some of these results. Actually, in pathology laboratory, but this, which is not commonly used anyway, one of the best way to take care of this very high lipid, in a case of hyperlipidemia, what you are going to do is to consider ultracentrifugation. This is the effective method of making sure you take care of, you remove that very lipid. But unfortunately, that is not commonly used in pathology laboratory, or if those used, it requires a specialized equipment and can be what? Time consuming. Okay, but I hope you now know how to handle the question in a case of what to do if you get a high lipid sample in biochemistry laboratory. Question number 7. What will you do if your QC fell in the morning and evening? Now, I'm not going to teach this. I'm going to run it quickly. I just want to make a point. So number 1, obviously, you're going to check your QC samples, and we already have a video on that. You're going to check the reagent, and you're going to do maintenance where possible. You're going to do calibration where possible. You're going to report to the senior or laboratory manager, obviously, and you're going to document event and action that you have taken, okay? And then you can contact the manufacturer engineers, okay, to come and look at it. Now, where I want to pay attention, because we already have video on this, okay, so you can listen to that video, is this. Note, the QC fails in the morning and in the evening. If a QC fails 2 times a day, there is something wrong. You may have solved the problem in the morning, the QC now pass, okay, now you continue running your patient test. Now in the evening, it now fell again. There is a possibility that there is something that is affecting, maybe something is happening with the analyzer itself, okay? Or it can also be due to maybe some certain reagent, maybe if they are very sensitive, as the case may be, okay? But in most cases, you might need to pay attention to the possibility of making sure that the analyzer, and maybe you call the engineer to look at it and find out if there is anything that is actually, affecting that result. Let me give you example, affecting the QC. Let me give you an example. Imagine something like bacterial contamination, mild, very small bacterial contamination in one of the channels, okay? What happened is that, okay, if that QC passed, you may have done the maintenance, fell in the morning, you may have done the maintenance, and you kind of wash it off a little bit, but the contamination is still there. And in the evening, it starts building up and the QC starts failing again. So there may be something happening in the analyzer, like the channels, as the case may be, and that should be taken care of. That could, or maybe the reagent can be sensitive with light or sensitive with time, as the case may be, and that can explain why the QC should fail 2 times a day. Now, another reason why the QC can also fail 2 times a day could actually be experience, the effect with the personnel. How good is the personnel that is doing that QC? For example, maybe the personnel forget to mix the sample very well. As simple as it is, because you don't mix it very well, it will fail. So it's an issue. So what I'm trying to say that in addition to what you are going to do, like I've highlighted, I want you to lay more emphasis on the fact that the QC failed in the morning and in the evening, and this is not right. So something needs to be looked at. What exactly is the problem? Question number 8, we are getting there. Okay, we have 10 questions. I know this is taking long, but hopefully you'll find it interesting. So question number 8, if a baby sample is insufficient for all the tests requested for, what would you do? A baby sample is insufficient for all the tests requested. Remember, it's a baby. Is a baby. You don't want to be puncturing the baby all the time. Anyway, what are you going to do? 1, you prioritize a test. Among all the tests that is required, what is the main test that can be done? What are the tests that sample that you have can be able to provide? You prioritize the test. And what it means that you cannot communicate with the team, like maybe your senior member of staff or manager, or you can even, of course, you can do that communication. Of course, you can also optimize the sample use. Find out the volume of the sample I have. What and what can you do? Can I use another technique? Is there another thing that can be done? So what exactly can be done to see that we maximize the usage of the sample that we're seeing? Okay. Now, another thing I want to say is this: in communication with the team as well, it's also important. I think I'm going to show you that as we continue. But let me say it here, that you also might need to find out with the clinician, okay, this sample is insufficient. Which test would you like us to do? Which one would you like us to focus on running? Okay. That is how you can be able, that is one of the ways you might need to optimize the sample use. Okay. Now, of course, you can request a new sample. Obviously, you request for a new samples, and that new sample is to help you to complete the test where possible. Okay. And of course, you are going to inform the clinician. But most important thing here is, if you're going to prioritize the test, it is not up to you to prioritize the test. You might need to communicate with the teams, like maybe with the clinicians, and find out from them. Is there anything you will, this cannot do all the tests. What test will you like me to prioritize? So you can now act based on that before you can now optimize and so on. And of course, you are going to inform the clinicians, and after informing them, about the sample being insufficient, requesting for a repeat, you can document every activity that has happened, what you did, okay, and all your communication with the clinicians, you can document it and report it. This can help you to have evidence of how you have handled that patient sample. I hope that makes sense. Question number 9. How would you handle equipment failure? Again, I'm going to try not to teach this. First of all, you identify the problem. So you find out what exactly is the problem. You can stop the equipment. Once you stop the equipment, you can now notify the relevant personnel, like your senior member of staff, okay? You can, maybe your laboratory manager, including even the engineers, the manufacturer of the equipment. You can notify them what is going on, okay? Then you can do troubleshooting to see how you can be able to take care of that problem. Then the next thing you're going to do is to record the incident, because it's an incident. If equipment, fail, okay, what is going to have impact on the service that laboratory is going to be provided, and that is an incident, and that needs to be recorded, okay. And following that, okay, you can switch back to what? You can switch to what? Backup equipment, meaning that in the pathology laboratory, in most cases, we have a backup equipment. We don't just make use of one equipment. We have maybe 2 or 3 as the case may be. So you can then switch to backup equipment. If you have done everything and you are not able to solve the problem, if you're able to solve the problem after troubleshooting, happy days, you still record and report what has happened. But if at the end you are not able to do anything, switch to backup equipment. Then of course you can arrange for repair. Of course, you are going to invite the engineers to come and look at it. Now, you can assess the impact it has on the test. That equipment failure, what impact does it have on the test? The result that the sample that has gone through it already, Is it any possibility that the result has been affected? So you might need to repeat it with the analyzer that you think that is working. So anyway, you assess the impact it's going to have on the test, meaning that the sample that has already gone through that very analyzer. Now, you are going to communicate with the stakeholders, maybe things like the A&E, or maybe the doctors, or the different world. In any way you can be able to communicate to show laboratory is done, the equipment is down. It is important that the doctors know that the laboratory is down. That will help them to see how they can manage the patient, okay, while waiting for the laboratory to come up and running. I hope that makes sense. And this is also important because what they will now do is that they may not need to start sending only the urgent samples. And because the test at this point, if you don't have a backup analyzer, okay, it means then that you have to do the test manually. That's what it means. Okay, so is it good that you let them know? So you review and improve the procedure. So you now need to review what has led to this, what has caused to this. Whatever thing has caused to this, you can now review it. And once you review it, it can help you to come up with the best way that can be done. It is actually in things like this that SOP can be updated, as the case may be. I hope that makes sense. Finally, question number 10. Please, if you're enjoying this, can I ask you to subscribe, like, share? Thank you. Now, tell me about the test that can be performed when there is Addison disease. Test that can be performed when there is Addison disease. This Addison disease is mainly associated with adrenal. So what it means, if there is insufficient, okay, first of all, this adrenal help in the, of course, it regulates the heart rate and blood pressure. So what it means that if for any reason this adrenal gland do not produce sufficient amount of certain hormones, that can now lead to Addison disease. I hope that makes sense. Okay, so meaning that this Addison disease is primarily has to do with the adrenal insufficiency, meaning the adrenal gland is not able to produce, or function effectively due to this insufficiency, and that can lead to this inability to produce sufficient amount of certain hormones, such as things like maybe cortisol, like which are stress response hormone, or aldosterone, okay, which of course help to regulate the blood pressure, things like sodium, like salt and potassium, helping in the balance, as the case may be. So if that is affected, it can lead to Addison disease. I hope that makes sense, because from adrenal gland they can help to produce cortisol, okay, they can also help to produce aldosterone. So when there is insufficiency of the very adrenal gland, it will not function very well. Okay, if there's a dysfunction of adrenal gland, it will affect the production of cortisol, it will affect the production of aldosterone. I hope that makes sense. So the test we now need to do, we might need to consider things like electrolytes, glucose, blood urea nitrogen, okay, and creatinine. I hope that makes sense. Okay, why? Because of the relationship. Remember, I've mentioned the its role in heart rate and blood pressure, sodium, potassium, as the case may be. So it's important that the electrolyte and creatinine and all of that is mentioned. Now let's continue with the answer. Now, because it has to do with the hormone, we now look at the hormone level, things like serum cortisol or serum adrenocorticotropic hormone, okay, or even ACTH stimulation hormone, as the case may be. Now, obviously, we're also going to look at thyroid function tests, and we're also going to look at autoimmune antibody screening to see whether what is affecting the adrenal gland is it due to autoimmune disease. Okay, we can look at also renin activity and aldosterone levels. Okay, we can also look at 21 hydroxylase antibodies. Okay, we can look at imaging. Of course, when it comes to the imaging, obviously it's not the laboratory, it's other section of the hospital that does that, like abdominal CT scan and all of that. Okay, see in the question the test you are now going to do. Now let me show you what the result is going to be. Number one, electrolyte, you're going to see hyponatremia, meaning that the sodium is going to be low. Then you're going to get something like hyperkalemia, meaning that the potassium is going to be high. Okay, now you're going to see something like hypoglycemia, glucose level is going to be low, and you're going to see something like bone and the creatinine is going to be elevated, and this could be due to dehydration or renal problem. Cortisol is going to be low, obviously, and ACTH is going to be elevated, and of course TFT is going to be high. It's going to be thyroiditis. Why? Because there's inflammation in the thyroid. So here we go. Thank you very much for listening. I hope you did enjoy it. can I ask you to subscribe, share, like, and comment? Let me know what you think about this format of the video that I want to start making. Thank you very much. Till I come back away again, I wish you all the best. Bye.